Hi class, this is Lisa. So I'm going to give my own experience of how I would implement a successful simulation experience for my fellow students. So the way that I would do this is to create a clear and concise syllabus that includes the requirements to pass the simulation course. Then I must have to be aware of the clear time constraints that are necessary, as in real life situations like medication windows are implemented for this particular reason. So I would make sure that I implement a strategy that my students are aware of in terms of their of managing time management and number of patients that they're going to be giving medications to, the length of the application window, and multiple strategies that are useful for the time management. And also I would make sure that I have clear guidelines that must be followed, as this will be examined as in a real life medication administration during a simulation lab. I would make sure that my students are able to demonstrate before the lab that they're aware of what they're doing and how they're doing it as well before they begin. And that's also in the form of the like 6 medication rights. I would also make sure that my students are able to locate the right medication, read the doctor's orders for the medication dosage, make sure you have your medications ready, and know like which patient that they're administering the medication to. And also, another task in my outline is that I would demonstrate, how they're speaking with, the staff members in the lab as well. If there's a patient tech on the floor, um, make sure I ask my tech, you know, what blood pressure, what vital signs were the patient before I even give the medication. Um, Also, I would implement how to demonstrate to properly store the medication and make sure, to take care of the necessary equipment properly. I would also make sure my students demonstrate how to dispose of medication appropriately, and what, and then if it's a narcotic, and how to dispose properly as well. And lastly, I would make sure that my students can demonstrate to me how to document the medication in the patient's chart within the allotted time window. Okay. And by making sure this goes successfully, I would make sure I paired a student between maybe 2 to 3 students in um, one simulation rotation as well, so that way it's just more conducive for me. Okay, looking forward to your response. Thank you.